Hi, I'm Dr. Trava. I'm an endodontist practicing in northern Jersey. Currently, we have 4 practices and 5 endodontists working at the practice and our different locations. Probably the single most important purchase that we've made in our practice is our 3D imaging machine, which has helped our practice not only grow, but give our patients much better service and help many more patients and increase the diversity of patients that we can see. It has changed the practice and the way the doctors have practiced in this office tremendously. Many teeth that we thought we couldn't save, that were referred to us, we now can save. Many teeth that doctors thought needed a root canal ended up not needing a root canal. Many times it's not just a tooth. A lot of times pain can come from other things. Sinus and TMJ. The versatility of the machine allows us to pinpoint that and figure out exactly sometimes where the pain's coming from or where the pain is not coming from. Instead of the patient going from doctor hopping from one doctor to another doctor to another doctor, all of a sudden they go from the doctor here to the right doctor that they need. And the patients are always much happier because now they're not wasting all the time from work, driving around. Some of the big surprises is that we really had no surprises. The technology works great. There's been a few times where we've called the Planmeca Technology Center. They were able to remote in, fix the software issue within minutes from when I called. Also, the big surprises is the amount of upgrades we get all the time. It seems like every year we get another upgrade at no charge, which gives us more versatility in the software, better diagnosing. Implant library has increased up to 2,000 implants, and third-party integration is seamless. A big concern that we had was also exposure and radiation dose. It gives us 4 different body types: child, teenager, female, and large adult. It also gives us different jaw sizes, and it also gives us 16 KVs, and it gives us 12 MAs. So, and we can go from a small volume size to a large volume size. So depending on the size of your patient, you can tailor the exposure and the amount of radiation to suit it for that size patient. Many machines don't give you that versatility. We decided to go with Planmeca because what I didn't realize that Planmeca is like the largest company in the world. And it is a large imaging company. It's not sold and it's not sold off and traded off to other companies. They've been doing research for years. You can start off with a small pan unit that gives you also the super bite wing, and then you can expand to the 3D unit by never changing the actual unit in the office. So they can add the software to your machine, so as your practice grows, you can also upgrade. I would recommend the ProMax 3D imaging unit for 3 reasons. One would be versatility. You can go from 2D to 3D, you can go from large to small volume size. Very important when considering a machine. The next is upgradability. If your practice is small, you can start with one of the smaller units and eventually graduate to a larger unit, adding different software packages as needed without changing the unit in your office. And next, and the most important, is detail. The ProMax 3D by far gives you the best detail out of any machine on the market. I've looked at many scans from many different machines and many patients, and by far the detail in the ProMax 3D is by far the best on the market.